Hi, my name is Ahava, and I've been coming to the clinic here for about 2 months. I am originally from the United States, as you can tell from my accent, and I've been living in Israel for the past 25 years. I was diagnosed first with stage 3 ovarian cancer when I was 36 years old in 2012. And I began the usual regimen of surgery and chemotherapy. And I achieved a no evidence of disease diagnosis at that time. And I experienced a very short remission. And unfortunately, by July of the next year, there was evidence of disease again in my pelvis. And we waited until there were actual tumors to begin a second round of treatment. In retrospect, we probably think that I was originally diagnosed with stage 4 ovarian cancer. And so now in 2018, we're looking at my 7th year of life. I have been through chemotherapy. This is my 5th time going through chemotherapy. I have tried other therapies such as PARPs inhibitors, which are the new rage for ovarian and breast cancer. I am a BRCA1 carrier, so I have a genetic form of ovarian cancer as well. So I have tried everything. I spent nearly 6 months in the United States being treated at a hospital in California with immunotherapy, with a drug that has been known to have cured ex-President Carter of brain cancer. And I was lucky enough to try Keytruda. Lucky. It didn't help me. In fact, the cancer seemed to advance after I did immunotherapy. I'm very lucky to have a supportive family, both my immediate family and my extended family, as well as a community of friends who support me spiritually. And that spiritual help keeps me strong and keeps me going. This is my last ditch effort. I came to Istanbul, Turkey, after my parents, mainly my father, investigated the opportunity to kill cancer with the ketogenic diet. The ketogenic diet, as some of you may know, is a diet which is as low in carbohydrates as possible. So I began trying this diet to help me keep the cancer at bay. And in 2014, I actually achieved another remission. And I believe that much of it was due to the fact that I did eat a very low carb diet, as well as I used fasting a day before the chemotherapy, during the chemotherapy, and a day after. So by fasting, I felt that I was weakening the cancer cells because healthy cells can continue without sugar and carbohydrates, while the cancer cells are less strong. They're a weaker type of cell, a less intelligent type of cell. And I feel that by my fasting and eating a low carb diet, I actually helped my chemotherapy work better. And I did achieve another remission. So after returning home from California at the end of 2017, I was basically told that I've run out of options. I have tried every treatment that is out there for my type of ovarian cancer. I had been through 4 rounds, 4 different rounds of chemotherapy treatments, and was considered platinum resistant. And as I was beginning to die, I just made the decision that this is my last chance. There's nothing left to treat me in my country, where we have fabulous, fabulous healthcare in Israel. but there was nothing left for me to try. So with my parents' help in finding this wonderful clinic here in Istanbul, Turkey, and after speaking with Dr. Slocum, I arrived here in Istanbul and had a talk with the doctors here, both with Dr. Sali and Dr. Slocum, and we decided to try, even though my cancer was very advanced and we didn't know if it would have an effect, if the treatment would be able to help me. And I'm a happily married mother of 5 young children, so I decided that I had to try. So I'm very happy to say that after only 3 rounds of treatment here, I had a PET CT scan, and the difference of my scan from the end of July until now is phenomenally improved, and I'm clinically looking better. I had a pregnant tummy like this when I first got here, full of fluid and tumor, and now, as you can see, my tummy is flat again, and I'm feeling better. And that's on a clinical level. On a physical clinical level, I can see that I'm doing better. However, what really tells us what's going on inside my body is the scan, and that gives me tremendous hope. So being here and having doctors who are willing to treat such an advanced cancer patient is very special and very unusual in the world. And this is really the only place that we could find that would agree to try to save my life. And now I have hope for the future. So here, I'll continue to come here until the cancer is gone. And I believe that will happen because I've met so many other patients here just by talking to them and befriending people from all over the world. I see that it is possible to get rid of stage 4 cancer. I will probably be dealing with this disease for the rest of my life. However, there's hope for a life. And that's why I'm here, because I want to live. So I definitely recommend this clinic in Istanbul, Turkey. Though it may seem far from home, it's a place that can give you hope. And I have faith and I have hope that someday I may not have to come here anymore, or perhaps I'll come here less frequently for maintenance treatments. So thank you very much for listening. And if you are in a situation or if you know somebody who has stage 4 cancer, it's definitely worth looking into.